I am Dr. G.K. Sinha, veterinarian, talking to you from Jaipur. Today, I will talk about an important disease of dog, which you might be knowing, that is known as head tilt. सर जरा सा घुमा हुआ, एक तरफ सर टिल्ट किया हुआ है ना. The head is tilted to one side, and that is a common occurrence in the clinic, and it happens in many breed. Now you see, this is basically, it is a neurologic problem in dogs, and cats also do suffer. But I will concentrate my knowledge and lecture on dog. In this condition, there is a lesion in vestibular portion of central and peripheral parts of the brain. Now you see this and the nerve involved. If you remember, or you might have heard my lecture on YouTube, I discussed about all the 12 cranial nerves in the animals, particularly in the dogs. Now this here in the head tilt of the dog, number 8 cranial nerves is involved. This involvement disturbs vestibular system of the dog. Now see what happens here is very, very important. The nerve becomes weak, and the main cause which we have seen in the clinical practice is infection of the ear, and mostly it begins in the external ear, then middle ear, and internal ear. So that part is infected, and what is the important symptom here is that the dog starts shaking his head like this and turns his head towards one side. If the left side is infected, it will turn to the left hand side, or if it is right side, then it turns to right hand side. And there will be, if infection is there, mostly it is due to infection. But there are some other causes also. Injury is one important. If somebody has bitten the dog on the head side, yes, this nerve may be involved, and there may be a head tilt. So important is that what symptoms a doctor will observe. The clinician sitting in the hospital will observe tilted head. Then he will also see ataxia. He will see circling movement of the dog, even rolling, because dog is in troublesome condition, and it is nystagmus. Nystagmus means the eyeball is rotated. So these symptoms, it indicates that something wrong with this disease, this condition. Now the important point of this is that the balance is also disturbed. And the balance means, what I mean to say you, that the movement of the dog is also disturbed. So a doctor who is sitting in his chamber or standing, he can diagnose the disease from a distance. 10, 50, 20 feet from away the dog is coming, then it is there. Now, what a line of treatment, what should we do? What I advise you, that the first thing, that ear should be cleaned, ear should be examined. So, and suppose you get cerumen or some pus is coming there, some bad smell is coming there, then it's to the ear must be cleaned very properly, because it's important to clean. And then we have to put few drops of common antibiotic in the ear directly. We can use gentamicin, which is being used very well, gentamicin ear drop, and many other antibiotics are available in the dog. Tobramycin ear drop, yes, we can give, and ampicillin we can use. Intramuscular also we can give injection. But I feel that cleaning is very, very important. The other part of treatment will be a good treatment and care, will good care by the owner. Owner should observe the dog. The dog should not be disturbed. Drinking water should be 24 hours available there so that he does not move much and he does not serve drinking water here and there. So water should be available there. Then I advise, in my practice I have given, you see, a neurobian tablet I have given, or injection of vitamin B1, B6 and B12 also I have given, and it can go. Then methylcobalamin tablet also, it can be given very well. Now it will be advisable from my side that the antibiotic which we are putting in the ear as a ear drop, that antibiotic or that ear drop, it will be advisable that it contains antifungal also, ketoconazole, miconazole and all that. Even fluconazole also, oral, can be given 150 milligram tablet to a adult dog. Now if we do this, then I think it will take some time. It is not very easy that dog will recover because it has affected the nerve and it will take time. But with good care and all that, we have seen many dogs, they recover very well, and we should keep the ear, eyes and everything in a good way, very clean way. Now I think I have given you, this is a small clinical tip I have given, and hope that you can treat your dogs in this way. Thank you very much for listening my advice and lecture. Next time I will be talking on some other disease where how to take care of the old dogs.